Warts, very common. I tell people all the time, good luck going through life without getting some warts, both literally and figuratively. They're actually caused by a virus, so they're actually an infection. So they are fundamentally contagious. People want to know, like, where did I get this, though? And I just tell people the wart virus is everywhere in our environment. It just takes the right person, right place, right time. Often we see them on things like feet and hands because you're touching objects or maybe walking barefoot at the house or in the gym. Signs and symptoms depend a little bit on where they're located. Sometimes if they're in an easy-to-see area like the hands, you'll actually see a bump, and sometimes they'll see these little black dots and things. They'll call them seeds or whatever. But so you can either visually see it if it's in an obvious-to-see area, or sometimes it comes to your attention due to pain, especially if they're on the feet. Plantar warts are very common, and people often aren't inspecting their feet that closely. But what can happen is they'll walk and they'll feel like there's a rock in their shoe, or they'll notice some discomfort, and when then they look close, they'll see actually there's a wart there. There's a lot of treatments available for warts, both in the office and at home, prescription and over the counter. They are challenging to treat, and I always warn the patients it may take more than one treatment, and it may take treatments both in the office and at home. But the main treatments we think about are freezing them with liquid nitrogen. The stuff we have in the office is much colder than the stuff you get over the counter. The over the counter stuff is about 80 degrees below zero. The stuff we use is about 320 degrees below zero. We also have something called blister beetle juice, which can break up the cells and kind of try and blister the wart off. We also have an injection that you can do that has a yeast antigen to try to draw in the immune system to get rid of that viral infection. And again, we have some prescription things we can also give for patients to use at home. For warts, the easier you can get after them when they're small, the better, and the easier they are to treat. When they start growing and multiplying and clustering together, especially on the feet, can be really challenging. So the sooner we can start getting after them, the better.